My name is Liesl Jacobs, and I work in the psychology department as a senior lecturer. The reason why I am doing this training session is because I worked with systematic reviews before. I worked for an organization called the South African Monitoring and Evaluation Association, and there I dealt with a lot of evaluations, and then not a lot of people know this, but systematic reviews are actually seen as part of evaluation research. And so government even has a department within the presidency that focuses specifically on monitoring and evaluation, and they include systematic reviews as part of the work that they expect from government employees. So this is very important work, but not a lot of people know how to do it correctly. A lot of people know of the Cochrane method, but the JBI method, which is what I'm going to be talking about, is relatively new. It started in 2015 and it's housed by the University of Adelaide. And so what you are seeing is basically my adaptation of it. So when I say adaptation, I don't mean that I've changed any of the protocol, but it's just a simpler way of looking at the manual that they have on their website. So anybody is free to click on the link that's in the manual and you can actually look at the complete manual. But I know that it's quite, difficult for students to navigate through this if you don't have any background of systematic reviews. And so I thought it's better to just sort of, reduce it to a step-by-step process where as people can easily follow and not get distracted, because it can be a bit overwhelming. My students struggle a lot with the different steps that's required with the JBI method. So if you go further down, you'll see that I have a disclaimer where I say it's interpreted by me. So this document is not the actual document that JBI has on their website, but it's just a bit simpler. So I've worked with the JBI method with most of my postgraduate students, and about 4 honors students successfully graduated doing this systematic review. It's very difficult when you apply for ethics. Before we had the system where we didn't have to apply for ethics, where we did have to apply for ethics, irrespective of it being a systematic review, because not a lot of people understand the difference between a systematic review and a desktop review. And I've been asked by colleagues many times, why doesn't your student just do a desktop review? And so I just wanted to first off say that there is a very clear, distinct difference. As we go along, you'll see there's a very big difference between a systematic review and just a normal literature review. Systematic review is basically a very detailed review of the literature, and it uses a precise question, and it keeps that question in mind while you're going step by step. So here I present an 8-step method of systematic reviews, but this is not, the first step is not to formulate a research question. It's just that they state it that way. The first step is actually to plan the systematic review. And if you go further down, you'll see that it's important to know why you want to do a systematic review. Sometimes it's not necessary to do one because systematic reviews are registered. So if you do a JBI systematic review, you have to register it on the JBI system, or you can go to the JBI system, you can go to the Cochrane database, you can go to all these different databases, and you can actually search and see if a systematic review was done on this particular topic that you want to do it on. And if it's been done before about 3 years ago, then you can do it. But if it's still very new, like if it's a year or two that the same topic has been done and a systematic review was done on that topic, then you are not allowed to do it. So basically, there's a few strategic things that you need to think when you are planning to do a systematic review. You have to look at, obviously, the date, how long ago a similar topic was done. What I usually do with my students is, some people do systematic reviews based on a particular country or context. So if you have a topic and it hasn't been researched in South Africa or Africa, but the topic was done in, let's say, in the Americas or in Europe, you can still do the systematic review on the same topic, but it has to be on the African continent, for example. And I find that that sort of helps a bit, but it has to be mentioned in your topic. Otherwise, the database will say that it's been done before. So when you are looking to plan a systematic review, you have to know if the methods are reflective and if it's a specific criteria of interest for your topic. And also if there is a gap in terms of the population. So I just mentioned in South Africa, for example, if it hasn't been done, then it's a good idea for you to go and do the review, but mention that it's done in the African context. So JBI requests that, as the Cochrane method as well, requests that you register your review title and protocol. And I did send an attachment where you can register. There's a form that you have to fill out where you basically register your title. And this is only so that people know that it has been done before, or it hasn't been done before, so that people can see if it's necessary to do a systematic review on that topic. So that form is fairly simple. You just fill out your topic and your interest and your methods, and then you submit it. So systematic reviews have standards, and when you look at clinical trials are considered the gold standard in research, and systematic reviews are considered the gold standard of reviews, which means there's very high standards, and there's a lot of checklists and things. There's a lot of steps to do when you actually conduct a systematic review. And the JBI endorses the PRISMA statement. And so the PRISMA statement stands for the preferred reporting items for systematic reviews and meta-analysis. And this evidence is just based on a 27 item checklist and a 4-phase flowchart diagram, which I also sent through, so you should be able to look at that. And we'll discuss that a bit later. So PRISMA is recognized as the standard for reporting evidence in systematic reviews, and it's commonly used. And actually, first of all, systematic reviews has been used in the health sciences first. They actually originated from there, and so it's also now been used in other fields of study. But the benefits is that it demonstrates to the reader that the quality of your review. It also helps the reader to assess the strengths and the weaknesses of your review, and it also makes sure that you follow the structure and the format that the review using the PRISMA headings. So step 4 is the title of a qualitative review. And the reason why I'm focusing focusing on qualitative reviews because I consider myself to be a critical qualitative researcher, and basically all of my reviews that I've ever done has only been qualitative, and so this is the example that I'm going to give you. The title should be informative, and like any other research project, your title has to reflect your research question, your objectives, and your inclusion criteria. And the sort of, I think it's a acronym, PICO. PICO is basically a structured question or a structured element that is part of your title, but it's also part of your research. Your research question stems from PICO. So population, the phenomena of interest, and context. So if you are doing a quantitative review, the O in PICO would be outcomes, but in qualitative research, there isn't outcomes. And so that's why the P is for population or the phenomenon of interest, and the CO is the CO in the context. And that is what you have to flesh out within your title of your qualitative review. So that's the next step. So how do we review our question? The step 5 is then to start developing our question. And so again, the PICO mnemonic is used to construct a clear and meaningful question for the JBI systematic review. So there's no need for an outcome statement, like I said before, because we are doing a qualitative synthesis. And so the review question or the mnemonic can provide readers with a significant amount of information. So already, if you write out your PICO statement, the reader will know what the focus of the study is, what the scope is, how it's going to be applied in the review, and it just immediately you know what you're reading, what's happening in this particular research, which is very helpful. So we're at step 6, and now only we're starting to talk about the introduction. So the introduction of a systematic review is very simple, and it's literally the same as you would for any other research project. But what is different with the systematic review is that you have to state the PICO statement and the inclusion criteria, and you have to place it in context. You will also provide, obviously, a context to the review like you always would in any other research project. But the main thing here is the PICO statement and the inclusion criteria, and then defining the key terms and operational definitions. Those are all things that we already do in our research projects. But what's different in an introduction for a systematic review is the PICO statement. Okay, so now we're moving on to the inclusion criteria, and this is a very long section because it's very difficult. If you don't get this section right, it basically throws off everything, and that's why the PICO statement is so important, because now you're basically fleshing out what you're actually going to include in your research project. And so for systematic review, the participants aren't human beings or animals or anything. The participants are actually articles. So this is secondary research. The participants needs to be very clear, and there needs to be a link to the question. So when I say review question, I mean the PICO statement, because the PICO statement is later on revised to state questions. So yeah. So if I would give an example of a study of mine, basically I am doing a gender responsive treatment for substance use disorder, and my age range is between 18 and 75, and my gender group is queer individuals, and so that's also my population. And what I'm looking at is a diagnosis of substance use disorder. And so people need to have been diagnosed within the last 6 months. And my population is also clearly described to avoid any confusion around that. So specific exclusions based on any participant or population characteristics will also be articulated in this section. So for example, patients who are heterosexual would not be included in my study. So the phenomenon of interest is where you would basically say, what are you interested in? So if I could use my study again as an example, gender responsiveness in treatment for substance use disorder is the phenomenon of interest, and the experiences that queer individuals have with substance use treatment. So that is basically what the phenomenon of interest would be. So that's the PI of the PICO statement. So now we're moving on to the CO, and the context is basically, depending on what the objectives and the questions of the review is, the context includes either cultural or subcultural factors. For example, a student of mine is doing a study on Xhosa culture and substance use disorder in Cradock. And so her context is basically the Xhosa culture, and the geographic location is Cradock. And so that is what you would state under the context. So that's basically your PICO statement under the methodology section. So the types of studies, there are 3 different kinds of studies that you can do for 3 different options, that you can use for a qualitative review. And it just depends on your design. So the options are really just your methodological approach. So whether you use phenomenology, grounded theory, ethnography, action research, feminist research, this has to be stated very clearly. So what types of studies are you going to look at? For me and my study on gender responsiveness in substance use treatment is basically a queer feminist research project. So you can choose any one of the 3 options. So of course, for a systematic review, the search strategy is very different to the search strategy that you would do for a desktop literature review, because it's very technical. And I would advise that you contact your subject librarian. Your librarian would become your best friend when you are doing a systematic review, because you constantly have to ask for assistance for different databases that you would access. So there are a couple of phases that you would have to go through when you narrow down your search strategy. And so the first phase is divided into 2 steps. First, you have to identify what your keywords are based on the subject that you are studying. And so you will have to create a logic grid of keywords, and the librarian can help you to do this. The analysis of the text words contained in the titles and the abstracts of papers, and the index terms used in the bibliographic database is also helpful to describe relevant articles in order to build a comprehensive and specific search strategy. And librarians are trained to do this, so you don't have to stress about what type of search strategy you're going to use, because librarians are very useful in helping you with this phase. And then phase 2, you basically also need the librarian's help to put you in touch with different databases that is specific to your subject of choice. Phase 3 then involves just reviewing the actual reference list of the studies that you retrieved, which will also help you with your search. Okay, so I've already said that there are different search databases that you can search, and the databases is just like, for example, I'm in psychology, so I would use social science databases. I would use PubMed because of my study being, you know, within the public health sphere as well. So once you have selected the databases and you've looked at the studies that came up, you would have to assess the methodological quality of these studies so that you can know whether or not they are eligible for inclusion in your review. There is an attachment that I sent where you can clearly see what is expected in terms of the PRISMA statement, what you are supposed to be looking for to make sure that your method is of quality. Yeah. Yes, there we go. The critical appraisal checklist for qualitative. So those are the questions that you need to look at when you are basically going through the abstracts or reading through the articles. It's a lot of work, but once this is done, then you can actually go to the extraction tool which JBI provides, and you basically simply just fill this out. So you will sit with, depending on your topic, you will probably sit with hundreds of these pages, but this will help you when it comes to analysis so that you can look for similarities within all these studies that you complete on this form. Okay, so then the qualitative data synthesis is simply just a method that you would use to analyze the above data extraction form. So what I usually do is I either put all these forms on my wall, I stick them on my wall, or I sit on the floor and I look at them and I then try and code them using thematic analysis, and then I categorize if, you know, certain studies belong together, like if there are similarities within the study. So it's like opening up a packet of jelly beans and throwing them out and then saying, oh, okay, I see, all the red ones stick together, the blue ones stick together. But what's important then is to look at the red jelly beans and see which of them are a bit deformed or not really good, you know, well placed in a particular category. And that's how you would then reduce the number of articles that you would fit into your PRISMA flowchart.